The goal, I think, for the Center for Inclusion Health is to transform healthcare. We try to bring populations of patients into the healthcare system, those who have traditionally been excluded from care. For one reason or another, they found those doors to the healthcare system closed. And what the center tried to do was to open those doors for people.
By putting a name, giving a face, a voice to people that really need to be allowed to talk, tell their story, what's going on in their life, and then be given the proper respect and treatment that they need. We've developed 12 programs, I think it is, in CIH over the past 10 years. We had one employee on day one, right? But now we have programs for many different underserved individuals.
I would remember we would get together in a conference room, and one by one, we just started tackling these various issues, and we grew and grew and grew.
To see the way that programs have evolved and grown and the amount of staff we've been able to add to really hit all of those gaps and, to keep finding more gaps that we're so interested in making sure we close.
With the addition of those individuals and boots on the ground, that people know who we are everywhere. Out on the streets, they know who we are, they know how to access us, they know that they can come up and talk to us, that we can try to provide them services exactly where they are.
Initially with homelessness and housing insecurity and developing a street team, but then we quickly evolved to substance use care, to food insecurity and having our healthy food centers. We incorporated transgender care into our services, as is immigrant health. We've also have programs in intimate partner violence and post-incarceration care. We're doing a lot in the mobile health world right now, and we just started a collaboration with the Veterans Place. A lot of those individuals are housing insecure or have housing instability. And so we're starting to understand what the healthcare needs are for that population and then develop services for them. One exciting collaboration we have is with the Humane Animal Rescue of Pittsburgh, or HARP. And by providing both medical and veterinarian care all together in the same space at the same time allows us to really capture people.
There's always something else that we're striving towards. We're not okay with complacency. We're not okay with leaving it where we are. We're always going to find a way to try to include those people that need us.
We think of ourselves as an innovator and an incubator of ideas. One of these ideas is not so new, but it hasn't been used in a long time, I think, in healthcare systems, and that's of community health workers.
Some of our community health workers are really there, boots on the ground, directly in front of them, and have some similar lived experiences that they can talk about, that they can establish common ground and perhaps develop that friendship or that baseline relationship that's going to get them one step closer to the office.
I am that guy that wakes up and then I go to bed and I'm grateful to be alive because I shouldn't be here. I always used to ask myself an interesting question about entering into recovery, like why did I get it? In 4 years, why do I have it? I don't know. I don't know what the answer is to that, right? But I know that I can offer it, and I can offer it again and again and again. It's a necessity. It's born out of a need to do that, because what was done for me, I can give back to somebody else.
When I get people that come back to me and say, you were the only person that listened, I'm coming back to AHM because you and your team treated me with the respect that I deserved, and that's huge to me. That's the reason I continue to do what I do.
I was working with a gentleman who was sleeping outside, sleeping in the rough, and I had watched him in a very short period of time latch on to that help that was presented to him, utilize it, and start to turn his life around in a sense that he was no longer unstably housed and going to college for culinary school. So it's just a beautiful sight to behold.
All of our employees do this work not because it's a job. They do it because this is the kind of way they want to dedicate their lives. This is where they find their joy. This is where they find their inner fulfillment. And it's truly, I think, what sets us apart.